Hi everyone, my name is Dr. Tera Pfarr and I'm a chiropractor at Brown Family Chiropractic. Today I would like to talk to you about disc herniations or disc protrusions that I commonly see in my clinic. We generally have them in our low backs, usually L4, L5 levels, or our necks. C5, C6 are the most common levels that we can have that disc protrusion or disc herniation. And with that condition, we generally have tingling or numbness in our fingers if it's in our neck, or that sciatic pain or pain shooting down to our foot in our legs. So what a protrusion or disc herniation is there's I like to call it a pillow or a cushion between every vertebra of your spine, and if there's a little weakness or little tear in that disc, that I call it jelly filling if you think of it as a donut, can squeeze out and it can cause inflammation around the nerve root that leaves that level, and that's why you get those symptoms into your leg or down into your fingers. So how chiropractic works with that is, first of all, we need to stabilize that disc level that's being irritated and protect it, because I say if you cut your knuckle and you do this all day long, is that ever going to heal? No, we need to stabilize it so then that injury can heal up and resolve itself. So adjustments, we adjust below that level and maybe above that level to help keep everything nice and mobile and take some stress off of that area. That is a great way to help, we call it centralize, or get that pain in your foot or your fingers to come back to your core or the central part of your body. That is a sign of healing. So that's something we like to see. So adjustments can help centralize that. I always throw nutrition in as well, because we do a lot of nutrition and supplements at this office. There is anti-inflammatory supplements such as omega-3s or fish oils that are great anti-inflammatories. Turmeric is another great anti-inflammatory, because again, we need to get that inflammation down to help our body heal and our pain go away. Disc herniations, because discs have very low blood supply, are kind of slower healers. I have usually seen them fully resolve in about 2 to 3 months with routine care and supplementation. But I just had a patient, maybe 2 or 3 weeks ago. He had a pretty severe disc protrusion, and I worked on him for maybe 3 to 4 weeks. And his pain was almost completely gone. He was back playing basketball, which was his goal after we had all that injury, and he got to avoid any other interventions such as cortisone injections or surgery, which was the next step for him. So it was a great thing for him to heal up naturally and holistically without having to do more invasive care. So disc herniations in either your neck or your low back, again, come to the chiropractor for it. I've had people call and say, do you guys work on this? Yes, we do. I see it all the time, and 80% of the time it resolves with chiropractic care alone. So if you have a disc herniation, give our office a call. If you're sick of that pain shooting down to your foot, give our office a call. We would love to work with you.
How do you determine if they're not part of that 80% and they should go to a doctor or x-rays or something else?
Good question. So if you are that 20% that doesn't respond with chiropractic care, we usually refer you out to get some cortisone injections and or physical therapy and or another consult by an orthopedic surgeon maybe to resolve that, because sometimes it's just a finicky issue that your body's just not getting over that hump. And sometimes if you get that cortisone injection, I can get a little bit more movement, and then we can finally see that progression. We kind of got to break that pain cycle sometimes, because when you guys are in pain, I know it's so frustrating and so tiring on your body. So a lot of the times, maybe some adjunct joint communication and work with another doctor is a great thing. So we're not just chiropractors and that's the only thing that works. We love to work with other practitioners that can aid and help you guys as well.